protection when the firm selling eyewear also controls the doctors writing the prescription. What happened to that lawsuit, and where are we at today? And why did he file that suit on behalf of California?
Thank you, Mr. Ng. I will ask if you want to respond.
If I can, and I may ask legal counsel to come up as well. That particular lawsuit has settled. That was a Pearl case, if I remember correctly, and that has settled. And that was filed due to advertising claims, actually. Pearl Vision at that time advertised that they jointly care for eyes, and the AG determined that that was inappropriate, and that was settled. Subsequent to that, the National Association of Optometrists and Opticians filed a suit related to the actual direct ban on hiring of an optometrist. And that's the suit that we're currently in today. So the first part of that suit, the federal judge actually determined that there was no evidence of harm to patient care during that suit. That suit, however, when it went to the 9th District, was reversed due to they didn't use the right technical or Pikes decision. So that's now been remanded down to the lower court to determine its outcome. And there, I'm sort of truncating part of the process, so I think we're okay. I'm getting the nod. So to answer your question related to the patient protections, there's been a couple suits since then, but that suit was originally because of the joint advertising that was brought by Lockyer, actually. And now we're subsequently in suits related to the constitutionality, actually, of the Business and Professions Code.
Yeah, my understanding of the settlement was over also the issue of a possible violation of patient confidentiality. And I understand that there was a settlement with no fault. I do have a concern. My second question is, why not let the Ninth Circuit, who remanded to the district court to apply the Pike decision to the Commerce Clause, why not let that lawsuit play out?
Continue.
And then have a decision that would then be a regional decision, and that possibly would not be in conflict with what California would do now through the bill?
That decision actually is related to Business and Professions Code 655, which is particular to that direct employment, or that optical company direct employment. So that would be LensCrafters being able to hire, for example, a doctor. This particular bill does two things. It does not permit it doesn't touch that section of the law. So LensCrafters under this bill would not be permitted to directly hire. It actually just allows for the relationship between the eye exam or Knox-Keene plan that employs physicians that currently can. I'm sorry.
Can I continue questioning?
Yeah, we got four.
Okay, I'm sorry, I don't want what's it called, a colloquy? But anyway, I am concerned about that, and my concern was that if the rationale for the bill was to lay the lawsuits to rest, and you're telling me that the lawsuit in question of the remand from the 9th back to the district court is irrelevant, then I
don't want to say it's irrelevant. I don't want to represent that
So
fact.
if it's not irrelevant, then why not wait for the answer that could come back that could possibly lay these issues to rest? Anyway, for those reasons, I'm going to lay off the bill for now. I will see the bill again in Business and Professions, and I hope to have some of my questions answered. I just learned about some of these issues recently and did some other research of my own. I appreciate the presentation and commend you for bringing it forth. Thank you.
Thank you. Other questions or comments from committee members? We have a motion and a second. This is a do pass and refer to Business and Professions and Consumer Protection. The amendments will be taken in B&P. Just before we move to your close in a vote, I am encouraged by your commitment to work with the Optometrists Association and their reciprocal commitment. I don't know if there's ultimately reconcilable differences here, but there's a ways to go on this, and I'd be encouraged by your commitment to keep that line of communication open, and would offer our staff and engagement if we can be of any assistance in that further dialogue. With that, would invite you to close.
Thank you, Mr. Chairman, and I again appreciate your assistance and that of your staff already on this, as well as other issues. I would just say that this really is about providing certainty for an existing business model. We're happy to continue to work with the opposition and others, and the comments like those by Assemblymember Ng. But I would also say, certainly to address the concerns about adequate protections, but also from undue corporate influence. Millions of Californians prefer to get their glasses where and when they see their eye doctor. The convenience and accessibility of a co-located model is an integral part of our healthcare system. I see a private physician, not one of the facilities. I can't confess to having a lens crafter's pair of glasses, but my eye doctor does both in-house. So I think it really is about options for clients and patients. And AB 778 will give these entities stability that they need to maintain operations in our state and continue to provide quality eye care options and vision services. So I would ask for your aye vote today. Thank you.
And before we move to a vote, Vice Chair Logue has a question or comment?
Just a quick statement. Due to Mr. Ng's question and further testimony, I will be laying off. Thank you.
Thank you. And with that, we'll ask the clerk to take the roll. Do pass, refer to business and professions amendments to be taken there as presented.
Monning.
Call the roll. Aye.
Monning, aye. Logue. Amiano.
Aye.
Amiano, aye. Atkins. Aye. Atkins, aye. Bonilla. Bonilla, aye. Ng. Garrick. Aye. Garrick, aye. Gordon. Hayashi. Aye. Hayashi, aye. Hernandez. Aye. Hernandez, aye. Lowenthal. Mansour. Aye. Mansour, aye. Mitchell. Aye. Mitchell, aye. Nastandi. No. Nastandi, no. Pan. Perez. Silva. Aye. Silva, aye. Smythe. Williams. Williams, aye.
That has 11. The bill is out. Thank you, Ms. Atkins. And now we're going to move to item 11, AB 507. Ms. Hayashi. We're on the home stretch, folks. We have Ms. Hayashi, followed by Ms. Bonilla, and then I'm presenting two at the end. And we are going to need members to start coming back. We've got some number of bills on call.
Thank you, Mr. Chair and members.
And just before you proceed, I do want to mention, I think I failed to mention that Mr. Chesbro did pull item 18, AB 824. That is not being heard today. Thank you, Ms. Hayashi.
Thank you, Mr. Chair and members. AB 507 eliminates barriers to appropriate pain management, improving the quality of life for cancer patients. Pain is the most common reason Americans access the health care system and is a leading contributor to health care costs.
Move the bill. Second.
Thank you. I have a witness here from the American Cancer Society to testify in support.
I'm Alicia Sanchez with the American Cancer Society. We are the sponsor of AB 507 because cancer is a painful disease, and we want to ensure that the patients who are facing cancer have adequate treatment, the appropriate treatment. And I should also note that treatment has pain associated with it, but pain issues can continue after a person has finished with their treatment, becoming more of a chronic issue. At least a third of cancer patients report pain after the treatment concludes. And unfortunately, pain is undertreated. According to Society's data, we have an 800 number that is a 24-hour hotline, and we looked at a subset of those callers to look at what they're dealing with in terms of patients. And we found that 75% of those patients who had pain and had reported it to their healthcare team were still facing severe or moderate pain. So there's some kind of disconnect happening. There's a lot of reasons that this happens, but we do know that regulatory barriers can be a contributing factor to that, and we want to address those. So AB 507 is one of the ways that we seek to do that by eliminating conflicting or obsolete language in the laws that deal with the treatment of pain. And the foundation for this bill is looking at a balance between the legitimate need to protect public safety, since the foundation of pain treatment relies upon the use of opioids, which obviously have the potential for abuse, and the imperative to address the public health problem of unrelieved pain. So with that, I would actually like to say that the American Cancer Society is working on this as a part of a broader pain community. We do have our immediate concern for cancer patients, but we're looking at this in pain as a pain issue generally. And Mark McGinn has joined us today, spent the long afternoon with us, who's a person in pain, to just provide, again, a brief snapshot of what pain patients have to face.
Thank
I
you.
urge your support. Thank you.
Good afternoon, Mr. Chairman and committee members. My name is Mark McGinn, and I've been in pain for 45 years. I've been asked to be brief with this, so I will be. I am one of 2.9 million Californians who suffer from chronic pain, and most people suffering from chronic pain in this state, as in every other state, go undertreated or non-treated. These issues are being addressed across the country, and we have a chance to do that here in California. I'm not going to go into my whole pain story. Just let it be known that I have been in pain forever. I've lost my profession. I lost my professorship. I finally found a doctor here in California who would treat me, put me on opioids, and my life changed completely. I have, however, not gotten everything back, nor will I ever, but I'm now able to stop being on the sidelines of my life, and it was because I found a physician who would treat me. So I would strongly urge your support for this bill, and thank you for listening to me.
Thank you for being here. Thank you for your patience as well this afternoon. Any other witnesses in support? Any witnesses in opposition? Questions or comments from committee members? Seeing none, this is a. Do we have? I'm sorry, Mr. Amiano.
Just move the bill.
We got a motion. Is there a second? We have a motion and a second. This is a do pass and refer to Business and Professions and Consumer Protection. Ms. Hayashi, do you know anybody in that committee?
Yes, several people.
Thank you. Would you like to close?
Respectfully request your aye vote today.
Thank you. Ask the clerk to call the roll.
Monning?
Aye.
Monning, aye. Logue?
No.
Logue, no. Amiano?
Aye.
Amiano, aye. Atkins? Bonilla? Bonilla, aye. Ing?
Aye.
Ing, aye. Garrick? Garrick, no. Gordon? Hayashi?
Aye.
Hayashi, aye. Hernandez? Hernandez, aye. Lowenthal? Lowenthal, aye. Mansour? Mansour, no. Mitchell? Mitchell, aye. Nastandi? Pan? Perez? Silva? Silva, no. Smythe? Williams?
That has 8, needs 2 more. It'll be on call. Thank you, Ms. Hayashi. And now we're going to move to item 17, AB 792. Ms. Bonilla. Is it toffee? Yeah. My favorite, too.
We can almost say good evening. Thank you, Mr. Chair and members. It's my pleasure to present AB 792. First, I'd like to thank the Chair and the committee staff for their help in refining this measure, and I'm happy to take up as author amendments changes included in the mock-up. I commit to continue to work with the Chair and the committee staff on the remaining issues, specifically on the issues of duplicate notices and the issues around the process of declining coverage. AB 792 builds on and improves on the Affordable Care Act and the work done last year by the Speaker to create a California Health Benefits Exchange. Half of the uninsured are uninsured for less than a year. Today, when they lose your job, when someone loses their job, they're all too often losing their coverage as well. If you get divorced or otherwise lose your spouse, all too often you also lose coverage. Kids turning 27 also lose coverage. I happen to personally be in my family in this situation where I have a daughter who's just turning 27, just left her job, and she is going to be without coverage coming Monday. This is a real issue. COBRA works for some, but only 20% of those eligible for COBRA take it, partly because the same event that makes you eligible for COBRA also reduces your income at the very moment when you have to pay for health insurance out of your own pocket. AB 792 creates an alternate to COBRA by initiating enrollment into the exchange for people who are losing their coverage because they lost their job or got divorced. Furthermore, it requires courts to provide a notice to those seeking to adopt a child on the availability of Medi-Cal and coverage through the exchange. How would it work? Well, the people who are losing their coverage would get a notice about the availability of this coverage, and their information would be provided to the exchange to initiate the process of enrolling them. No longer would losing your job mean automatically losing coverage. Instead, people could stay covered while in between jobs. With the Affordable Care Act implementation rapidly approaching, we must move forward to create mechanisms to maximize consumer enrollment in health care coverage, specifically to ensure seamless coverage for individuals who go through life changes that would otherwise leave them uninsured. I have Beth Capel with Health Access here, the sponsor of this measure, to testify in support.
Thank you.
Mr. Chair and members, Beth Capel on behalf of Health Access California. We're pleased to be the sponsor of this measure. This is complementary to Ms. Atkins' bill, which you heard earlier. This is for people who lose their private coverage to help them get enrolled in the exchange. Half of the uninsured are uninsured for less than a year. I think most of us think of being uninsured as a condition that goes on for a long time. But for lots of folks, they're between jobs or something happened that they lost their coverage. With the existence of the exchange and the new rules for Medi-Cal, people no longer have to become uninsured in those circumstances. We believe that with this and the earlier measure, we can cover a substantial share of the uninsured. Thank you.
Mr. Chair and members, Sarah Flocks from the California Labor Federation in support of this bill. Major life transitions, including losing a job, usually mean that a person will lose coverage. The exchange offers the opportunity to bridge the gap in those gaps in coverage. This is especially important since California has lost 1.4 million jobs since the recession began in 2007. There's 2.3 million unemployed Californians, and unemployment is stubbornly high at 12.5%. These are people who have lost coverage, and this bill would provide the opportunity for seamless enrollment and to prevent those gaps in coverage for the unemployed, for people who lose their job, who lose their spouse, or have a divorce or any other major life transition. And for those reasons, we support this bill and urge your aye vote.
Thank you. Other witnesses in support?
Elizabeth Landsberg with the Western Center on Law and Poverty here in support.
Chad Silva on behalf of the Latino Health Alliance in full support.
Allison Ramey on behalf of the California Primary Care Association in support.
Any other witnesses in support? Seeing none witnesses in opposition, please come forward.
Thank you, Mr. Chairman. Ann Eowan with the Association of California Life and Health Insurance Companies. Our position is opposed unless amended. We simply just have some workability concerns. I think the Assemblywoman mentioned two of those. We want to make sure that there are not duplicative notices that go out. It probably makes more sense just to send this out with the COBRA notice that already goes out. And also to make sure that there are not some liability issues with trying to get that kind of consent from someone to transfer what might be private information forward. We've already engaged in, I think, some very constructive conversations, and I appreciate the outreach from the author's office as well as with the sponsors. But at this time, we haven't fixed it all, so we're still opposed unless amended.
Thank you.
Charles Bakke with the California Association of Health Plans. We're actually not officially opposed to the bill. I did want to thank the authors, her staff, the sponsor for providing us with these mock-up amendments. We think they're helpful, and we're going to take them back. We just got them today and analyze them and see where we go from here. But did want to extend our thanks to them for being very constructive so far. Thank you.
Thank you. Any other witnesses in opposition? Seeing none, questions from committee members? Comments? Mr. Nastandi.
Thank you, Mr. Chair. On the eligibility, if you lost your job or you move off the coverage of an employer, is there any other requirement then to be eligible for the exchange? I thought there was other requirements you had to meet.
I believe it's under 400% of poverty.
That's what I thought. So that would still apply then.
Under 400% of poverty, you're eligible for a subsidy. Any individual could enroll in coverage through the exchange, even if their income was higher. It's just that they only get the subsidy if they're below that income level.
Okay.
But it creates a place for individuals to obtain coverage as well who are higher income.
Thank you, Mr. Chair.
Any other questions, comments? I'm willing to entertain a motion, and then I have a motion and a second. And just before you close, Ms. Bonilla, I want to thank you for the work to date with our staff and the proposed amendments that will be taken in the Judiciary Committee because of the timing of presentation here today. I do want to offer our committee's continued interest in working with you and the supporters, as well as with opponents, to try to iron out some of the fine details. But we appreciate your bringing this forward, and with that, would invite you to close.
Thank you very much. It certainly is our intention to work out all the issues so that this can be successfully implemented, and with that, I would ask for your aye vote.
Thank you. We have a motion and a second. This is due pass and refer to Judiciary. Amendments to be taken in the Judiciary Committee. Clerk, please call the roll.
Monning?
Aye.
Monning, aye. Logue? No. Logue, no. Amiano? Aye. Amiano, aye. Atkins? Bonilla? Bonilla, aye. Eng? Aye. Eng, aye. Garrick? No. Garrick, no. Gordon? Hayashi? Hernandez? Aye. Hernandez, aye. Lowenthal? Lowenthal, aye. Mansour? No. Mansour, no. Mitchell? Aye. Mitchell, aye. Nastandi? Pan? Perez? Silva? No. Silva, no. Smythe? No. Smythe, no. Williams?
That has 7, needs 3 more. That will move on to our illustrious call list. Thank you, Ms. Bonilla and witnesses. I'm now going to pass the gavel to Vice Chair Logue, and I will be presenting items 1 and 4. Thank you, Mr. Vice Chair. And just before I move down to the podium, I would ask the sergeants to start reaching out to our absent members to start getting people back here so that we can be expeditious in our final voting round. Thank you.
Oh, is it AB 43?
Thank you. Good afternoon, members. Thank you, Mr. Chair. As you know, passage of federal health care reform was a momentous occasion, provides California with the opportunity to provide coverage to almost 4.7 million of the 7 million non-elderly adults and children who were uninsured for all or part of 2009. California has already acted to establish a health benefits exchange, which held its first meeting last week. This bill is the vehicle for the piece that will allow us to expand Medi-Cal to include all childless adults who earn up to 133% of the federal poverty level. Federal law requires this to be implemented by 2014. The Medi-Cal waiver that was approved last year is a bridge to full implementation. It is estimated that up to 500,000 adults will be covered by the counties under the waiver. However, it is estimated that up to 1.8 million will become eligible under the 2014 expansion. The costs will be covered 100% by federal funds. It is imperative that we start planning now in order to provide for a smooth and orderly transition. I respectfully ask for your aye vote and would like to present witnesses for brief testimony and support.
Thank you, Mr. Chair and members. Kathy Sunderling with the County Welfare Directors Association. We are in support of the bill. So as Mr. Monning indicated, you're looking at about 500,000 to 1.8 million people becoming eligible for Medi-Cal on January 1st, 2014. The idea behind the bill here is to start a process and actually put the procedures in place to start to pre-enroll people as they come in during 2013 so we can have those folks ready to go on January 1 and to the greatest extent possible flip a switch and get them into the program. Start drawing down those federal funds for them, 100% for almost all of them, and also make sure that they have health coverage and can get the care that they need. Counties do eligibility for Medi-Cal. Counties will be very heavily involved, as you know, in the waiver, the low-income health programs that are mentioned in the bill. This bill will also apply to individuals in counties that may ultimately choose not to do a LIP, or people in those counties where the LIP has eligibility enrollment requirements, and there may be people above that, but who would still be eligible for Medi-Cal up to that 133% of poverty. Those are all really important groups to include. We really appreciate the amendments that we worked on with the author's office to make sure that all three of those groups are captured. Thanks.
Next witness, please.
Elizabeth Landsberg with the Western Center on Law and Poverty here in full support. Today, only certain low-income adults can get Medi-Cal. You have to be a pregnant woman, a parent, a senior, or a person with disability. So the group that's left out are these childless adults. Mr. Monning's AB 43 will make sure that all eligible low-income Californians can get access to health coverage, draw down those federal dollars, help relieve some of the burden on the counties today, and we're here in full support. Thank you.
Thank you. Any, your name and organization and position of support, please.
Beth Capel on behalf of Health Access and Support.
Kelly Brooks on behalf of the California State Association of Counties, the Urban Counties Caucus, and the County Health Executives Association of California in strong support.
Thank you.
Allison Ramey on behalf of the California Primary Care Association in support.
Chad Silva on behalf of the Latino Health Alliance in support.
Judy Rowland with NAMI California in strong support.
Thank you. Any anyone speaking in opposition, please come forward. If not, any members have any questions? Yes.
Mr. Chair, now the funding kicks in 2014, assuming everything goes as is and nothing changes, which there is a possibility of change in the law. But doesn't the federal money run out after 2 years, or what's the time frame?
Well, the bridge to 2014 is putting in position newly eligible folks. The commitment of federal funds through the waiver is part of that bridge, so that is guaranteed support. I'll defer to the witnesses as to what happens after 2016.
Yeah, so the 100% federal funds are in place for 2014 through 2016. It ramps down to 90% by 2020 and stays at a 90% federal match rate for the duration for these newly eligible Medi-Cal recipients.
Any other questions by the members?
I'm just thinking. Okay.
Are you done?
Yeah, thank you.
Thank you. Okay, Mr. Monning, would you like to close?
Yes, I appreciate everybody's patience and perseverance this afternoon. Respectfully ask for an aye vote.
Thank you. We have a motion.
Motion.
We do have.
I think there's
To
already.
pass and refer to appropriations. Roll call.
Monning?
Aye.
Monning, aye. Logue?
No.
Logue, no. Amiano?
Aye.
Amiano, aye. Atkins? Bonilla? Bonilla, aye. Ing?
No.
Garrick?
No.
Garrick, no. Gordon? Hayashi? Hernandez? Hernandez, aye. Lowenthal? Lowenthal, aye. Mansour? Mansour, no. Mitchell? Mitchell, aye. Nastandi? Nastandi, no. Pan? Perez? Perez, aye. Silva? Silva, no. Smythe? Smythe, no. Williams? Williams, aye. Needs two more.
What is it? It's 8 votes. We need 2 more on call.
Thank you, Mr. Chair. Thank you, members.
Next bill, item 4, AB 151.
Thank you, Mr. Chair and members. AB 151 does 3 things. First,
Second.
It deletes from California law references to Medicare supplement plans that are no longer available and adds 2 new available plans, Plans M and N. Second, if premiums are increased, this bill guarantees a Medicare Advantage plan enrollee or insured the opportunity to enroll in a Medicare supplement plan by the same Medicare Advantage issuer. Third, if the Medicare Advantage plan issuer does not offer any supplement plans and there's an increase in cost sharing or premiums, a reduction of benefits, or an enrollee's health care provider no longer contracts with a plan, then this bill guarantees that the enrollee is eligible for a Medicare supplement plan issued by any issuer. Medicare Advantage allows for private HMO or PPO coverage for the Medicare population. A federal subsidy previously provided to Medicare Advantage plans is being phased out under federal health reform. Many anticipate that Medicare Advantage plans will respond by increasing premiums on enrollees or pulling out of certain high-cost areas. This bill ensures that individuals affected by these Medicare Advantage changes can purchase supplemental coverage to help cover gaps in Medicare coverage. Respectfully ask for your aye vote. Mr. Chair would like to present a couple of witnesses in support.
Thank you.
Mr. Chair, Casey Young with AARP. We're pleased to sponsor this bill. One of the ways that federal health care reform was paid for was by reducing that subsidy to Medicare Advantage plans, which is basically having the government pay about 13% more for Medicare Advantage plans than original Medicare. It's being reduced in a very complex kind of formula over 2 to 6 years, and essentially Medicare Advantage plans are going to be offering a different deal because of that to consumers. We just want to make sure that when they get that different deal, one of the options they have is to go back to original Medicare and buy a Medigap plan.
Thank you.
We ask for your aye vote.
Beth Capel on behalf of Health Access California. The existing law in California predates the existence of Medicare Advantage plans. This bill would update the law to take into account the changes in federal health reform and the existence of Medicare Advantage plans. Thank you.
Thank you. Any witnesses in support? Your name and who you represent?
I'm sorry.
Okay. We have opposition come forward, please.
Opposition.
I know. That's for people who sign up.
Thank you. Ann Iowan with the Association of California Life and Health Insurance Companies. We represent the companies that provide Medicare supplement insurance. The existing right that's in the law now that allows folks in a Medicare Advantage plan to have an annual open enrollment into a Medicare supplement plan, we actually agreed to way back when with the folks who are up here supporting the bill. But that's because the risk would stay within the same existing carrier. It would be the same carrier providing the Medicare Advantage plan, and then they'd be going to the same Medicare supplement plan offered by the same carrier or an affiliate. What this bill does that's slightly different that we do have a concern about is it says that if you don't offer a Medicare supplement plan, then your enrollees who want to leave the Medicare Advantage plan can just go into anybody else's Medicare supplement plan. And then annually, as an open enrollment, can go back into Medicare Advantage. And what we're concerned about is that folks will shift risk as a result of some of the Medicare payment changes that will come up. And we've reached out to the author and the proponents and expressed this concern. I know that that's not the intent of the author, but I think we're going to have to make sure that we fix what we are concerned about in terms of shifting risk into Medicare supplement plans and allowing people to come right back into a Medicare Advantage plan once they get perhaps some high-cost surgeries or other things done under Medicare supplement. So until we fix those concerns, we have to unfortunately remain opposed. Thank you.
Thank you.
Mr. Chair and members, Maureen Higgins representing America's Health Insurance Plans. We have the same adverse selection risks that Ms. Iowan explained. We're concerned about people moving between Medicare Advantage and Medigap policies depending on their medical needs. We think this creates uncertainty in the marketplace and could create cost pressure on premiums in the Medigap market. So for that reason, we're opposed to the bill. Thank you.
Thank you very much. Opposition?
Nick Luizos, California Association of Health Plans, in opposition for the reasons stated. Thank you.
Thank you. Members, any questions from the members? Brian?
Rolling question. Mr. Chair, First of all, I've read that the Obama administration is putting the $15 billion that they proposed to cut for Medicare Advantage. They're adding $8 billion back into the system. So I think they're coming the other way, back around to supporting Medicare Advantage, which I think is a good thing. But if you could address her comment regarding, and I don't quite understand that process of how they would switch back and forth. Is that during open enrollment, or is that they can do that at any time?
I think what the bill contemplates is that if a carrier stops providing the supplemental care, it's no longer an option for somebody who's been a purchaser of that. What this bill tries to protect is the transferability. I think the concern of the carriers is the lack of predictability. I appreciate the concern. I think the objective of the legislation, first and foremost, is to protect patient transferability and options. And I think it's hard to have a marker. I think the companies put forth kind of the worst case scenario. I think in other situations where we've had open market or transferability, some of those fears haven't been realized. But I appreciate the concern. We're willing to work on it, but I think there's going to be an ultimate juxtaposition of the objectives of trying to protect patient transferability when a carrier.
Sure, and I apologize, I didn't quite understand that though. When they stopped supplying the benefit, does that mean?
Maybe if a carrier said we're no longer going to offer this product.
Well, wouldn't they have a right then to switch to?
That's what our bill says, is that you should then be able to move to another carrier.
If I can ask the opposition, if that's okay, Mr. Chair.
Yeah.
Just to clarify.
When they.
Okay.
So they stopped paying premiums then and everything. So
the way the bill works is that if there anything that changes in your Medicare Advantage plan, benefits, premium, anything, no threshold, then if you have guaranteed issue rights on an open enrollment annual basis to go into another Medicare supplement plan that's offered by that same insurer. But what this bill also adds to that existing right is that if your Medicare Advantage plan does not have another company that sells Medicare supplement insurance, then you as an enrollee would, if any premium benefit change occurred, you would be able to go into anyone's Medicare supplement policy because that carrier does not have a Medicare supplement policy. And so what we were concerned with is the difference between before you would keep the risk within the same company, but now the risk would be transferred perhaps to another company. And because of the annual open enrollments, that person could go into Medicare supplement, get a procedure done, and then at the end of the year, through open enrollment, go back into a Medicare Advantage plan, which is significantly cheaper. And so that's the issue we're trying to deal with in terms of making sure that people don't, on an annual basis, hop in and out of Medicare supplement plans based on
Mr.
risk.
Chairman, any change, any little change they can do that, you're saying? There's no threshold of the change that they could do that with?
Currently, there's not, because there's not that change. But again, the author has offered to work with us. If we could figure something out, we will.
And let me ask the representative from AARP to also address that question, perhaps with greater cogency than I did.
Mr. Nastandi, the way the bill will work is that if there is a change, as Ann was saying, that if there's a change now and that company that has a Medicare Advantage plan also has a Medigap plan, a supplemental plan, then they can change in most of these circumstances now. The only time they can't is if just the premium increases, okay? What she's expressing is that's fair to the insurance industry because it keeps it within the same company. But it puts the consumer in the position where if they happen to be with a Scan Health plan or a Kaiser or some other company that doesn't have a Medigap plan, they don't have that option. when, they reduce the benefits, when they increase the co-pays, or any of these kinds of things. We think if there are those kinds of changes, they should be able to get a Medigap plan, go back to original Medicare, if that makes sense to them at that time. We don't think the consumer should be at risk there.
And you don't see a problem with it messing up their risk adjustment?
We've talked about that. We don't. The concern that's been expressed is that people are going to, when they feel the need to go outside of their network, go into a Medigap plan, get a surgery or something, and then come back. And we can't find any evidence that that happens in other kinds of circumstances. For example, where you've got PERS, where you have managed care plans right up against PPO plans. They don't see the back and forth like this. So if there's evidence of that, we've indicated we'd be happy to work with them and try and work something out. But we're not seeing the problem. And frankly, we would be concerned about that as well. Our members buy Medigap policies, and if that happened on a big scale, premiums would be going up, and we'd be hearing about it from our members. We're not concerned about that. We have been on other kinds of cases, other kinds of circumstances, but this one we really don't.
Okay, thank you. Arthur, can you please finish?
Thank you.
Thank you. Okay, we do have a motion and a second. Do pass and refer to appropriations. Roll call.
Monning?
Aye.
Monning, aye. Logue?
No.
Logue, no. Amiano?
Aye.
Amiano, aye. Atkins? Atkins, aye. Bonilla? Bonilla, aye. Ing?
Aye.
Ing, aye. Garrick? No. Garrick, no. Gordon? Hayashi?
Aye.
Hayashi, aye. Hernandez?
Aye.
Hernandez, aye. Lowenthal? Lowenthal, aye. Mansour? Mansour, no. Mitchell? Mitchell, aye. Nastandi? Nastandi, aye. Pan?
Aye.
Pan, aye. Perez? Perez, aye. Silva? Smythe?
No.
Smythe, no. Williams? Aye. Williams, aye. Gordon? Gordon, aye.
Very much. To be continued. Absolutely. Thanks.
14, it's out. Thank you.
Thank you. Thank you, Mr. Logue. Members, I'm going to return, and we're going to start going through our outstanding bills, so thank you for all being here. We'll move quickly. Thank you.
Drinks all around, Mr. Chair.
Everybody loves somebody sometime. Good boy.
Hey, Cameron.
Okay, members, if I could have your attention, if we're systematic, I think we can do this
Automatic.
quickly.
Automatic. Everybody lose control.
We're going to start in file item order. We're going to start with item 1, AB 43.
Your mic's on.
And that's 2 votes shy. I'm going to ask the clerk to call the roll for missing members.
Atkins? Atkins, aye. Ing? Ing, aye. Gordon? Gordon, aye. Hayashi? Hayashi, aye. Pan? Pan, aye.
Did I vote on that?
Yes, you voted.
I did, because you were here.
That has 13.
Pardon?
That's 13. It's out.
That has 13. It is out. We're now going to move to item number 2, AB 52 by Mr. Fuhr. That needs 2 votes, and I'm going to ask the clerk to call the roll of absent members.
Lowenthal? Aye. Lowenthal, aye. Mitchell?
Aye.
Mitchell, aye. Perez?
Aye.
Perez, aye. Williams? Aye. Williams, aye. That's 12.
That has 12. The bill is out. We're going to move to item number 3, AB 88 by Mr. Huffman. Ask the clerk to call the roll. Absent members.
Logue?
No.
Logue, no. Bonilla? Hernandez? Lowenthal? Aye. Lowenthal, aye. Perez?
Staying on.
It has 9. Yes.
It has 9.
That's 9.
That has 9. Did you get Smythe on that vote?
Oh, sorry. Smythe, no.
That bill has 9. It's 1 short. Anybody reconsidering? Okay. Great. This was Huffman, AB 88. Labeling. Okay, that item fails. Item 3, AB 88. We're going to move on to item 5, AB 171 by Mr. Bell. Ask the clerk to read the roll.
Monning?
Aye.
Monning, aye. Amiano? Amiano, aye. Bonilla? Bonilla, aye. Eng? Eng, aye. Gordon? Hayashi? Hayashi, aye. Hernandez? Hernandez, aye. Lowenthal? Lowenthal, aye. Mitchell?
Aye.
Mitchell, aye. Perez?
Aye.
Perez, aye.
That has 12. The bill is out. We move next to item 6, AB 210 by Mr. Solorio. Ask the clerk to call the roll.
Amiano? Amiano, aye. Eng? Eng, aye. Gordon?
Aye.
Gordon, aye. Hayashi? Hayashi, aye. Lowenthal? Lowenthal, aye. Mansour? Mansour, no. Pan? Pan, aye. Perez?
Aye.
Perez, aye. Williams? Williams, aye.
That has 14. The bill is out. Next on-call item, item 9, AB 386 by Ms. Galgiani. Ask the clerk to call the roll of absent members.
Amiano? Amiano, aye. Eng? Eng, aye. Gordon? Gordon, aye. Hayashi? Hayashi, aye. Hernandez? Hernandez, aye. Lowenthal? Lowenthal, aye. Mitchell?
Aye.
Mitchell, aye. Pan? Pan, aye. Perez?
Aye.
Perez, aye. Smythe? Smythe, aye.
How many?
15.
That is 15. The bill is out. We move next to item 10, AB 412 by Mr. Williams. Ask the clerk to call the roll.
Logue? Amiano? Amiano, aye. Eng? Eng, aye. Gordon? Gordon, aye. Hayashi? Hayashi, aye. Lowenthal? Lowenthal, aye. Pan? Pan, aye. Perez? Perez, aye.
That has 15. The bill is out. We move next to item 11, AB 507 by Ms. Hayashi. Ask the clerk to call the roll.
Atkins?
Aye.
Atkins, aye. Gordon?
Aye.
Gordon, aye. Pan? Pan, aye. Perez? Perez, aye. Smythe? Williams? Williams? Williams, aye. 13.
15. That has 13. The bill is out. Moving next to item 13, AB 641 by Mr. Fuhr. Clerk will call the roll.
Monning?
Aye.
Monning, aye. Logue? Bonilla? Bonilla, aye. Eng? Eng, aye. Hayashi? Hayashi, aye. Hernandez? Hernandez, aye. Mitchell?
Aye.
Mitchell, aye. Nastandi? Perez? Perez, aye. Silva? Silva, no. Williams? Williams, aye. 13.
That has 13. The bill is out. Moving next to item 15, AB 714 by Ms. Atkins. Ask the clerk to call the roll.
Eng? Eng, aye. Gordon?
Aye.
Gordon, aye. Lowenthal? Lowenthal, aye. Pan? Pan, aye. Perez? Perez, aye. Williams? Williams, aye. That's 13.
That is 13. The bill is out. Moving next to item 17, AB 792 by Ms. Bonilla. I ask the clerk to call the roll.
Atkins?
Aye.
Atkins, aye. Gordon?
Aye.
Gordon, aye. Hayashi? Hayashi, aye. Pan?
Aye.
Pan, aye. Perez?
Aye.
Perez, aye. Williams?
Aye.
Williams, aye.
That is 13. The bill is out. Next item 19, AB 972 by Ms. Butler. Co-author Mr. Bell. Ask the clerk to call the roll.
Amiano? Amiano, aye. Eng? Eng, aye. Gordon?
Aye.
Gordon, aye. Hayashi? Hayashi, aye. Hernandez? Hernandez, aye. Lowenthal? Lowenthal, aye. Mitchell?
Aye.
Mitchell, aye. Pan? Pan, aye. Perez?
Aye.
Perez, aye. Smythe?
No.
Smythe, no. Williams?
Aye.
Williams, aye. 18.
That has 18. The bill is out. Item 20.
I'm sorry, 17.
Pardon?
17.
Well, that was item 17.
No, it was item 19. It has
That was 19.
17 votes.
Has 17 votes. Now we move to item 22. AB 1329 by Mr. Davis. Ask the clerk to call the roll.
Amiano? Amiano, aye. Eng? Eng, aye. Gordon?
Aye.
Gordon, aye. Hayashi? Hayashi, aye. Hernandez? Hernandez, aye. Lowenthal? Lowenthal, aye. Mitchell?
Aye.
Mitchell, aye. Pan? Pan, aye. Perez? Perez, aye. Smythe? Smythe, aye. Williams? Williams, aye.
Hear all about it tomorrow.
19.
That has 19. The bill is out. Okay, members, that completes the items on call. Now we're going to, in an orderly fashion, invite members to respectfully approach our clerk and add on. We will stand in adjournment. People can continue to add on. I want to thank the sergeants, the staff, and everyone for your patience and perseverance today. Thank you.